Hi, so my name is Kasey Ebb, and this is my COVID-19 health campaign. So, what is the illness? COVID-19, also known as the coronavirus. My campaign idea was to create a social media event to raise money for projects and educate people on the severity of the illness and how to take preventative measures. So, what is COVID-19? COVID-19 is an infectious disease caused by the coronavirus, SARS-CoV-2, that appeared late 2019. It is highly fatal, impacting mostly the upper respiratory system, but can also affect other organs. There have been about 582,000 deaths in the US and about 3.3 million deaths worldwide. The facts. So, up to 20% of hospital patients with COVID contracted it at the hospital, and more than 3,000 healthcare workers have died since the start of the pandemic. There were an additional 40 to 60 homeless deaths per month, with a lot of deaths going uncounted. And healthcare workers are also putting their families at risk by working in these hospitals. So the research methods that I used were first interviews. I conducted 3 interviews to get anecdotal information to support the form to form an idea of the communication aspect of this disease. And the second one I used was ethnographic studies. So I studied and researched death tolls, working environments, resources, and case studies. So my interviewees were first Dr. Carter. She is a physician. She's 44 years old. Her expertise are in infectious diseases, and she works directly with COVID patients. So most of her patients have pre-existing conditions and diseases because she is working in infectious diseases. So that makes her job that much harder. The fact that she's already working with patients that have COVID on top of another condition. The second person is Miss Walker, a registered nurse. She's 25 years old. She specializes in general medicine and has knowledge on infectious diseases and works directly with COVID patients, also making sure they're okay throughout the night, making sure they're comfortable, especially since a lot of these patients aren't able to see their families. The third person I interviewed was a COVID patient. She's 21 years old. Her symptoms included loss of smell and dizziness, and they lasted for about a week, and she didn't have any pre-existing conditions. However, the last person I interviewed was another COVID patient, and he is 48 years old, and his symptoms included a fever, fatigue, and congestion. His symptoms, however, lasted about 2 weeks long, and he had a pre-existing blood pressure and heart condition. So for the feedback that I received from my interviewees, Dr. Carter says, the rapidity of the spread, severity of the illness, and unknown patterns make COVID-19 particularly difficult to treat. Some patients are admitted with other health conditions that will make them more likely to have severe disease. So as I mentioned before, she does work with a lot of patients that have other health conditions, which makes it that much more difficult to treat. Ms. Walker says many families don't get to see their loved ones once they are admitted because their health deteriorates so quickly. So a lot of patients that are admitted, they aren't able to see their families because of how contagious this illness is, and the fact that hospitals have to reduce the amount of people that are in the building and also coming in contact with these COVID patients. And the second COVID patient says, having blood pressure issues did make my experience with COVID-19 more risky and serious and caused my recovery to take longer than I thought it would. So this just goes to show that there's a lot of unknown factors that come along with COVID, and there's a lot of things that people didn't know until they experienced it themselves or met someone that experienced something that had long-term issues or harder issues than the other person. So for my campaign, my target audience is COVID-19 patients, of course, healthcare workers, and also the loved ones of COVID-19 patients. So this takes up a big chunk of our population right now since COVID is like pretty much everywhere. And my objective is to spread awareness and educate people on the risk and preventative measures. Also, to provide resources for those in need, meaning masks and other things like that. Reduce the stress of healthcare workers and encourage people to wear masks. The impact that I'm hoping to make is to lower the amount of COVID cases overall, allow patients to be able to see their families, and for healthcare workers to not have to work as strenuously as they do. Okay, so my campaign goals are to distribute at-home testing kits for fast results and in the comfort of one's home. Also to provide homeless shelter for COVID-19 patients with on-site testing and isolation treatment if needed, because there have been a lot of homeless people that have gone overlooked or unseen because it's hard to know if they have COVID, one, and two, it's hard to really understand how what treatment they need or if they're suffering unless you examine them. So providing that shelter will also help to lower those numbers and to get people the help that they need. Um, the third one is to create a separate hospital building for COVID patients to reduce the spread and provide necessary gear to avoid the airborne contaminants. So the main issue for people not being able to see their families is because they need to reduce the amount of people that are in the hospital. So by separating COVID patients from regular patients, hopefully can bring these numbers and level them out. For the fourth one, data-free texts to schedule vaccine appointments and order free at-home tests and send updates after the campaign. So for my campaign timeline, I'm first going to host an Instagram live event where viewers are encouraged to vibe out in the comfort of their own homes, which also helps to reduce the spread because you're at home. Guest speakers will include Beyonce, Michelle Obama, and Will Smith, and they will talk about their own experiences with COVID-19. And they will hopefully help to encourage people to wear masks and get vaccines and to just lead them into the right direction because there's a lot of things that are being said that aren't necessarily true. So hopefully they can encourage people to follow CDC guidelines and also push our campaign as well. And I'll be using the hashtag get rid of the vid meaning COVID-19. So the campaign budget looks a little bit like this. For the sponsors, I'm hoping to use California Department of Health and Kaiser Permanente, two very known businesses and organizations. And for testing kit distribution, I'm guessing around 25 million for hospital building, 60 million for the homeless shelter, 40 million, with a total of 125 million. So that is a lot of money. So I'm hoping that part of it can come from the sponsors, but part of it can also come from the campaign itself. And Instagram being its own platform can help raise money depending on the amount of viewers we get, likes we get, and depending on the amount of advertisements that are being used. So communication post-campaign. Participants will be able to text a code to a number to subscribe to a newsletter, such as the picture that's shown right here. You can text, quote, something, and then you automatically get signed up. So the newsletter will consist of updates on the projects that were talked about at the campaign, tracking information for test kits, 24/7 support for people who ask questions, and lastly, to encourage viewers to use Instagram as an online support group. So for my marketing collateral, I thought it would be best to include the faces of real people who were impacted by COVID to help people understand that this is a real thing and this isn't just some type of conspiracy theory. Like this is real and it's really impacting people's lives, people's loved ones. And so this is a collage of photos of people of healthcare workers that lost their lives due to the pandemic since the pandemic started. And this is just a handful of people. There's so many more out there, but this is just a few faces that I think would touch certain people and um, draw some people towards the campaign because they see that these are real lives that were lost. So, in conclusion, the overall purpose of this campaign is to lower the number of COVID-19 cases, create a more efficient way of receiving a COVID test, reduce the stress of healthcare workers, and provide equal access for all people to be treated. My passion is helping people, and during this pandemic, many have received the short end of the stick, either because they lack the resources or because they're working on the front stage, constantly being exposed. My goal is to provide a circumstance where everyone can feel heard and also be educated about COVID-19. The overall objective of this campaign will be to shorten the length of the pandemic by assuring that everyone's needs are met. With more people being taken care of and less cases overall, the numbers will drop tremendously. So some communication themes that I saw that I was using throughout were a lot of health narrative types and health narrative functions. So for my health narrative types, I saw that I was using illness as a theme because that is, of course, the overall theme of my campaign. Efforts to heal because I would like to heal as many people and also prevent people from catching this illness, and restitution, meaning trying to get everyone's life as close to normal as it can again. And for health narrative functions, I saw that I was trying to create identification amongst people experiencing similar problems, meaning people who know someone who has COVID, people who have COVID themselves, or healthcare workers, just creating that sense of similarity in like, oh, I'm not the only person going through this. And secondly, a form of witnessing individual and community suffering and trauma. I hope to recognize everyone that has been through something that has been traumatic or something that has made them suffer due to losing someone to COVID or just having COVID and not being able to recover in the way that you wanted to, or even being a healthcare worker and witnessing so many deaths every single day. And here are my references and my appendix. Thank you.